Well, good afternoon. My name is Sumit Mehrotra, and I am with Valkasa. And today we are here with Dr. Donald Abrams, and we are talking about the role of vitamin D and cancer. So, Dr. Abrams, let's get started here. And the first question we have for you is why is vitamin D important in context of people with cancer?
Great, thank you, Sumit. So vitamin D actually is more of a hormone than a vitamin. When we learn about vitamin D and vitamin D deficiency in elementary school, we think of children with rickets, that vitamin D is responsible for making your bones strong. But in addition to that, and I've never seen a person with rickets in all my days, vitamin D does many, many other things. For older people, adults, the bone strength is important as well because vitamin D deposits calcium in the bones, and that's what keeps them strong. And many of our cancer patients, of course, are at risk to get either osteopenia, osteoporosis, or metastases to their bone, which is another reason we want to keep their bones strong and nurtured with calcium. And that's what vitamin D does. In addition to the bone health, vitamin D deficiency is rampant in the world. It's estimated that 1 billion people worldwide might be vitamin D deficient. And things that put people at risk for vitamin D deficiency are being over the age of 50, overweight, which so many of our American adults are, and having more skin pigmentation. And because so many adults are vitamin D deficient, the Institute of Medicine, in all their wisdom, lowered the lower limit of normal of the vitamin D blood tests from 30 nanograms per ml down to 20, because they felt that encompassed 95% of adults. I don't think that's fair to increase the number of people who are actually vitamin D deficient. We do know that vitamin D deficiency leads to increased risk of certain cancers. And we also know that patients with a number of different types of cancer are at greater risk for death if their vitamin D levels are low. So the vitamin D deficiency has been linked to breast, prostate, colon, and pancreatic cancer, some of the biggest ones that we deal with. And so the only blood test I ever order when I see a patient at the Osher Center for Integrative Health for an integrative oncology consultation is a 25-hydroxy vitamin D level. And my goal is to have that level between 40 and 50 nanograms per ml, despite the fact that many of the patients that I see start with a value 24 that's in the normal range, but I think that's cheating. Another reason I think it's important for cancer patients is because vitamin D, I think, is very important for our immunity. We talk about the flu season as if there's a bank of viruses waiting out there to come in and swarm upon us in November. What really happens is that we, as a herd, become vitamin D deficient. And that decreases our immunity and our ability to fight viruses. And I think immunity is very important in patients with cancer. In addition, there is some suggestion that low vitamin D levels may be related to depression and also chronic low back pain. So, these are some other reasons that it might be useful to know what your patient's vitamin D level is and to replace it. In prostate cancer, they've looked at calcitriol, which is a most active form of vitamin D as an actual anti-tumor agent. The studies didn't really demonstrate that much benefit, but it is something that was tried because there was a belief that it might, in fact, lead to better control of prostate cancer. So vitamin D, for many reasons, to me, is the main thing that I'm going to look for in my new patients that I see with cancer.
So that's fantastic information, Dr. Abrams. If you reflect a little bit on over your years that you've seen breast cancer, prostate cancer, pancreatic cancer patients, all of them where vitamin D levels are more critical. Roughly speaking, in your experience, what percentage of the people come to your consult with vitamin D levels in the 40 to 50 level of 25 OHT that you seek?
What percentage of people come with a normal level? De novo, really, I would say 10%. I
So
would
major
say, closer to 90% of patients that I see are vitamin D deficient or insufficient, depending on where you draw that line.
Okay. So that's very, very important to know, right? What you feel is ideal. Majority of the patients coming to see you are not there, which leads us to, what is an optimal way to supplement vitamin D when you see that situation.
Yeah, so vitamin D is a fat-soluble vitamin. Many people say, oh, I don't need to take vitamin D because I take it in my multivitamin, or I take this bone health product, which is vitamin D and calcium together. Vitamin D is best absorbed as a gel bead or a liquid, and not as a white powder in a capsule or tablet complex with calcium. So what I do is recommend that people take a gel bead of vitamin D3. When I see somebody who comes in with a very, very low vitamin D level, less than 20, I try to fill up their tank first with vitamin D2. Vitamin D2 is ergocalciferol. It's less potent than cholecalciferol, vitamin D3, but I use it one 50,000 international unit dose a week for 8 weeks while the patient is starting to take vitamin D3. So they do both concurrently. And then after the 8 weeks of the D2 to fill up the tank, then I redraw their vitamin D level to see where we got. In a patient that comes in, for example, like I said before, with 23 or 24, then I feel each 1,000 international units of vitamin D3 should raise the level 10 points. So if I want to get to 44 from 24, I say take 2,000 international units of vitamin D3. And then I'll check it again. Some patients want me to check it every month. I don't think we need to check it every month when we get to a level that's appropriate. But for people that are very low, I fill up the tank first or concurrently with starting the D3 by giving them a weekly dose of D2.
And how long does this journey take? So someone who came in with their vitamin D levels in the 20s, and you started them on the dose, the 50,000 IU dosage of D2, and then supplemented them with the D3 as well. How many weeks does it take? Is that within the 8 weeks of taking
Yeah, I
both?
mean, I don't usually draw the level before 8 weeks, so I can't tell you exactly when the tank gets filled up to a level that I'm happy with, but yeah.
But typically in 8 weeks, do you see the levels to
Yeah,
where you?
yeah, definitely, yeah. And a lot of people now are inclined to take vitamin D complex to vitamin K, another fat-soluble vitamin. And the reason that they do that is so that the calcium that the vitamin D is encouraging to be absorbed is deposited in bone. One of the risks of taking too much vitamin D is having the calcium deposited in blood vessels, particularly the coronary arteries and the aorta.
Right. So too much of vitamin D is also a problem. Too little is clearly a problem. Too much is a problem, like almost everything in life. So
Yeah, it's a U-shaped curve for mortality in vitamin D. That is, people with the highest and the lowest levels of vitamin D are at greater risk for death.
and at what level would you say you start entering the high end of risk?
It depends. Each lab has a different range of normal. Ours at UCSF goes to 50, but outside labs go to 100. So that gets me a little confused sometimes.
Okay, but if you were to give a broad guideline to people who've been supplementing and not testing, which is a lot of us, right, who've been just every day taking vitamin D and supplementing, and not testing, do you encourage people to test on a regular basis? And if so, what is the
No,
frequency?
as I said, I think one of my colleagues who is very much of a conservative clinician said it costs more to do the vitamin D test than to tell people to just supplement. But I think I like to know where the person is starting, and then I will supplement them to bring them into that 40 to 50 range, check to make sure they're there, and then I don't think we need to check regularly after that. But it is something, I have patients who say, oh, I got to 45, so I stopped. Well, I said, no, you're deficient because you're overweight, you're over 50, and you need to continue to take it as a supplement, especially older people. I mean, they do all these studies. Can we prevent fractures in older people? And the studies do weird things like give them 100,000 international unit dose once. And I never heard of such a thing. Why would you do that? I mean, you need vitamin D, which of course is a sunshine vitamin, every day, I think. And, because we live in a culture where dermatologists have us all very fearful of getting skin cancers from the sun. So everybody either doesn't go in the sun or protects themselves with SPF 60s and doesn't get any sun. But again, over 50, we don't make it so well from the sun anymore.
So once people have reached their optimal levels between 40 to 50, what is it, nanograms per liter? Is that the?
Per ml, yeah.
Per ml, okay.
That's my optimum level. I know that there are naturopaths and other functional medicine people who want people to be 70 to 100, but I'm just a little fearful of that. I don't think vitamin D is entirely benign.
Right, and that's what you were talking about, the U-shaped curve. So once you get your patients in the 40 to 50 range, you're okay with continued supplementation with vitamin D3, I assume.
Yeah.
Is that correct? And
Right.
at what level of supplementation, what dosage are you typically comfortable at that level?
So I did a practicum at the National Cancer Institute on nutrition and cancer a number of years ago. And it was a week-long program. And when they gave the lecture on vitamin D, I raised my hand and said, why don't we just put it in the water supply? Because it sounds like it's a panacea for everything. And they said doses over 4,000 international units a day are associated with calcification of the aorta, our
Right.
major blood vessel, artery. So that's something you don't want to have. And I do see people taking 5,000, 10,000, 50,000 of vitamin D3 a day. And I worry about that. Again, the new trend is to take it with vitamin K too, so that the calcium that you're absorbing more of gets deposited in bone instead of blood vessels. But I think that's giving a lot of responsibility to vitamin K2 personally. So I haven't jumped on the DK2 bandwagon like many of my patients have.
Okay, so this is very helpful. So you feel that supplementation is okay to continue, but nowhere close to 4,000 IUs or more per day. So what is the supplementation level that you're comfortable with? 1,000, 2,000
Yeah,
IUs?
1 to 2,000. I mean, the people that make up these rules say that people over 70 should take 800 international units. I don't even see capsules in that size here. Most of them, 1,000 is the bare minimum.
Okay. So if I were to summarize, so this was a fantastic conversation. So thank you so much, Dr. Abrams. So if we were to summarize our conversation, here's what I've heard, that over all your years of practicing integrative medicine, vitamin D is one such vitamin that has multiple benefits when it's at an optimal level. And it has significant harm or potential to cause harm when it's too little or too much. And that's what you called out as the U-shaped curve. And especially for cancer patients, you have seen vast majority, 80 to 90% or more of your cancer patients who come and see you, who are generally not at the optimal levels of vitamin D where you like to see them. So when you get a patient typically who is in the 20s, which is what you usually see, you supplement them with vitamin D2, 50,000 units for 8 weeks.
Less than 20, I would do. Yeah.
Less than 20.
Above 20, yeah.
50,000 units for 8 weeks, along with vitamin D3 over these 8 weeks. And generally, you find that people reach those optimal levels around 8 weeks' time when you retest them. And after that period, you like to see them on a sustained supplementation of vitamin D of 1,000 to 2,000 IUs, but never exceeding 4,000 IUs because that could be harmful, as you pointed out.
I mean, for a long duration, I wouldn't exceed that. Sometimes I do recommend 5,000. Now, I just want to say I have a colleague who's a African-American radiation oncologist in Detroit, And I asked her what level she aims for, because African American, people are hyperpigmented for maybe a reason sometimes, and you don't want to get too much vitamin D because of that calcification of coronary arteries. So she aims for 30 to 40 instead of 40 to 50. So there is some, leeway or manipulation that you need to do depending on race and skin color.
Excellent, excellent. But this was extremely helpful, and I'm sure our members will find this very helpful. So thank you very much for your time today, and we'll talk to you next about mushrooms. So look forward to that next conversation.
Okay.